everybody. My name is Peter Werwine. I'm Senior Editor at Managed Healthcare Executive. And today I really have the honor and privilege of taking some time from Dr. Robert Gabbay, who is Chief Scientific and Medical Officer of the American Diabetes Association. And before that, Dr. Gabbay was in a similar role at the Joslin Diabetes Center in Boston, which is part of Harvard. And he's still an associate professor of medicine at Harvard, and we're talking to him today. I'm in Philly, but he's in Boston, so hello.
Hello, Peter.
So the main topic of conversation I wanted to the main topic I wanted to talk to you about today was eye disease and diabetes. And I sort of wanted to start with a bit of just setting the floor of understanding about the relationship of diabetes to eye disease. Many of us are familiar with it, that diabetes increases one risk of vision problems and I guess blindness, but I'm not sure what the recent trends are in terms of diabetes causing serious eye disease. There are many more medications available, and I believe diabetes is probably better controlled in general than it used to be. So is it still a major problem?
Sadly, it is absolutely a major problem. And in fact, it is still the leading cause of blindness for working age adults. And so, we have a lot of work to do.
And are we talking type 2 diabetes here, or are the vision problems from diabetes both from type 1 and type 2?
They occur both in people with type 1 and type 2 diabetes. Of course, there are more people with type 2 diabetes. About 90% of people have type 2. So, but yeah, it's present in both, and the physiology seems quite similar in both cases.
So let's just talk about the physiology briefly. A lot of problems from diabetes seem to be the damage to the microvasculature. So is the eye disease from diabetes the result of damage of the microvasculature, particularly in the retina, so where there are many tiny little blood vessels? And is it just sort of the manifestation of that in the arena of the eye and vision?
Yeah, you have it exactly right. So it's those little vessels in the retina that become leaky. And as they become leaky, they cause the surrounding tissue to not get enough oxygen. That tissue produces a growth factor that leads to the formation of new blood vessels. The problem is those new blood vessels are not good blood vessels, and they're very friable. And when they break, there's a bleed into the eye and a sudden loss of vision.
And does it tend, the vision problems that people have, does it tend to happen gradually? And what is the experience like? Or is there a sudden onset?
Well, it can be some of both. So, the vision issues in diabetes range from, at the time of diagnosis, having blurry vision from high blood sugars, to the more chronic, what we're talking about, of retinopathy, where most of the damage occurs to the eye without any symptoms. And that's why it's so important to get a regular eye exam, because one would never know that damage was occurring. So that leaky vessel generally wouldn't even know it. Those new blood vessels forming that are not strong wouldn't know it. The only time you'd know it is when the vessels bleed, and the iris, the eyeball in essence, gets filled with blood and one loses vision. So it really can happen quite suddenly, but the process is slow and insidious.
And is there an age distribution to the problem, and it's the result of tending to have diabetes for a long time, or is this something that can occur early in the course of having the disease?
Generally, it's 5 years plus of the disease. The challenge being for people with type 2 diabetes, many don't know they have it. And so they could have had diabetes for 5 years before they're diagnosed. One interesting fact is that uh, many people are diagnosed with diabetes when they just go to see the eye doctor. And based on what the eye doctor sees, they say, oh, you should be tested for diabetes. So it really is underdiagnosed.
So a retinal exam reveals the sort of leakiness or the growth of these friable blood vessels, and that puts one on a diagnostic path to diabetes.
Exactly right. There's sort of the pathognomonic changes that one sees in the retina that really suggest, oh, this person likely has diabetes.
Now, is there any race or ethnic group distribution to be discussed here?
Yes, sadly, very much so. Blacks and Latinos are 50% more likely to have diabetes. And so the risks just go up that much higher. There are significant health disparities in terms of access to care. And again, what we're talking about here is getting yearly eye exam. And that really can prevent a lot because these changes that I described can be seen early, and there are treatments to prevent them from advancing the loss of vision.
So I understand that African Americans and Hispanics are disproportionately affected by diabetes, but among those with diabetes, are they disproportionately affected with eye disease?
But what I can say is they are disproportionately affected with poor glucose control, having higher A1Cs. And we know that, poor glucose control leads to more risk of eye disease.